or think you might be, know that you are not alone. Anxiety disorders affect millions of Americans every year, but help is available. There are lots of treatment options available, which, for many people, involves a combination of counseling, cognitive behavioral therapy (CBT), and medication. One anxiety medication you may have heard of is Buspir, a popular drug that is available as an affordable generic known as Busprin. Let's take a look at 7 key facts about Buspir below. 1. Buspir is often prescribed on top of an SSRI or SNRI. When treating generalized anxiety disorder, healthcare providers turn to SSRI selective serotonin reuptake inhibitor and SNRI serotonin norepinephrine reuptake inhibitor antidepressants first because they work well for a wide range of anxiety disorders and have been well studied. However, if the SSRI or SNRI only partly works for an individual, even at its maximum recommended dose, Buspir may be added on top for an enhanced effect. Another way Buspir is used is by itself. Some people may not respond to SSRIs or SNRIs at all, or may experience bothersome side effects when taking them. In these cases, Buspir might be a good option, and I've seen patients who have benefited from it. Be sure to talk to your provider about what treatment plan is right for you. 2. It works as well as Xanax, but has fewer side effects. When you think of anxiety medications, the first brand that comes to mind might be the blockbuster medication, Xanax. Xanax belongs to a class of drugs known as benzodiazepines, which historically were often used first to treat generalized anxiety disorder. As newer and safer medications have been developed, recommendations have shifted to prefer these newer medications instead. Research studies have shown that Buspir works as well as benzodiazepines, but with fewer side effects. Buspir is also not habit-forming like benzodiazepines are. In a study, Buspir worked as well as Xanax, but it resulted in fewer side effects as well as a lower risk for withdrawal symptoms. 3. Buspir has also been studied for depression. In addition to being prescribed for anxiety, Buspir is being studied for possible use in the treatment of depression. In these studies, researchers looked at whether Buspir could be useful for people who saw some benefit from SSRIs or SNRIs but still needed a little extra help. In one such study, about 1 in 3 people who did not get enough relief from depression after trying an SSRI benefited from adding Buspir to their treatment plan. 4. It is taken 2 or 3 times daily. Buspir is taken 2 or 3 times daily, but be sure to follow your provider's instructions on how you should take it. You can take it with or without food. However, you should pick one way when you start taking Buspir and then stick to it. I've found that it helps people to take Buspir with food simply because it helps them to remember to take it. If your provider wants you to take it 2 times daily, for example, you can take it with breakfast and dinner. If your provider wants you to take it 3 times daily, you can also take it with lunch. 2 things to remember with meal choices. Avoid drinking alcohol while taking Buspir. The two combined can make you feel really sedated and sleepy. Avoid drinking lots of grapefruit juice. Too much grapefruit juice can cause the levels of Buspir in your body to be unexpectedly high. 5. Buspir needs time to work. As with many anti-anxiety medications, Buspir won't work right away. For some people it can start to work in as little as 2 weeks, but for other people it can take longer. If you are waiting for Buspir to kick in, be sure to tell your healthcare provider if you need help with your anxiety in the meantime. Depending on your individual circumstances, they may recommend a benzodiazepine like Xanax or Ativan or hydroxyzine Vistoral. These medications are used for more immediate relief of anxiety symptoms. 6. Side effects from Buspir are usually mild. Most people do well taking Buspir, but all medications can have side effects. The most common side effects with Buspir are dizziness, drowsiness, nausea, headache, nervousness, fatigue. Talk to your provider if you experience any bothersome side effects with Buspir. They will help you decide if you should continue taking it or if you should switch to a different treatment option. Remember, withdrawal is less likely with Buspir than with benzodiazepines, but it's still possible. It may include symptoms like irritability, nausea, or muscle aches, and can occur if you suddenly stop taking the medication. To prevent this, talk to your provider if you want to stop taking Buspir. They'll work with you to slowly decrease your dose over time. 7. It is available generically at an affordable price. Technically, Buspir, the brand name medication, is no longer being marketed. Once its patent expired in 2001, the manufacturer stopped making it, and generic Busprin took over the market. Generic Buspir, or Busprin, is not expensive. The average retail price of 60 10 mg tablets is around $31. It is also covered by nearly all commercial and Medicare drug insurance plans. If you're paying out of pocket, a Goodrx coupon can help you save. The lowest Goodrx price for 60 10